sorry. What is it going to be that's going to, one, do a little bit to lead to an increase in muscle size and strength? But what we're really going to focus on is to what extent, okay? How much bigger can your muscles get? How much stronger can your muscles get? And kind of what are some of the adaptations that are going to underlie allowing both of those things to happen, okay? So what I want you to do first, and this is going to be just very quickly, okay? First kind of things that come to your mind is you can do this by yourself. You can do it with a partner or several people in a group, depending upon what you feel comfortable with. But just with the folks around you, you don't have to move your desks or do anything. You can do it in a group. I want you guys to come up with this bit of information for me. Okay? One, let's assume, okay? Let's assume that you can lift 100 pounds. We'll make our math easy. You can lift 100 pounds. If we have you do the world's most perfect resistance training program, whatever that might be, okay? Whatever that might be. In, say, 3 or 4 months, how much stronger are you going to be? So if I can lift 100 pounds now, what will I be able to lift in 3 or 4 months, okay? And if, let's just say, I have some amount of muscle mass, how much more muscle am I likely to have in 3 to 4 months? Assuming that I do everything perfectly, okay? Assuming I do all of this perfectly. So let's just take like 3 minutes. Yes, Dan?
How much experience prior to starting with this?
Oh, see, you're wanting to make it nuanced. I love this. This is a great question. But let's make an assumption that you've never done resistance training in your life. Okay? You are a naive resistance trainer. Okay? Daniel's question will make way more sense when we see a few things go on. But yes, let's assume that. You've never touched a weight in your life. Okay? All right, so you guys will have until like 10:38 by the clock in here. All right, so go. Write it down. You're going to turn it in. We're going to do a second thing in a few minutes. Okay, but just make sure your name and whoever you're working with's name is on it.
I think if you don't have any experience, probably take it slower first. Definitely no more than 2 hours.
Daniel, can you curl over now? With one hand? Okay. That would be astounding.
It's like how much stronger they're gonna get.
Sure, like it doesn't, if someone it doesn't matter. Whatever makes sense. Squat 100 pounds, bench press 100 pounds, dead, whatever.
Wait, what was the time frame?
3 to 4 months. 3 to 4 months.
I don't know what I got.
Okay. 50 more pounds.
Unless you're going to do like every it's even then the muscles don't have time to recover. So I just don't think
So what y'all come up with?
we're thinking maybe like a 25-pound increase.
Okay. Doesn't? Are you sure that it takes time? Maybe it doesn't take time.
Yes, it takes me time.
It takes you time, Madison?
Yeah. Takes me so much
Maybe you're
time.
not doing it correct.
My
I know,
coach
right?
is in there watching me.
Things that get me in trouble is when I tell our athletes that they're training incorrect.
How do you encourage forest sports and weight coaches though? I mean, Corey's fine. He's not playing with any of us this year. He ain't messing around. Kubitschek was a little light. Corey is not.
Well, I just was like, they were not required, at least 2 years. By law, you have to have a license. And so that to me is weird. Because I've heard plenty of stories. And
So,
just,
good,
not
good.
coaches doing this completely wrong thing. I'm like, that's horrifying. How do you break something?
All right, groups, are we close to having an answer? Now the fun part, give your group a name. We're gonna write the names on the board, and we're gonna put what you said. Then we're gonna revisit.
That's the funny thing, Jack, now nobody has to mask.
Okay, we're gonna start here, all right? What are you gonna call your group? Muscle monster, okay. All right, muscle monster. Okay, y'all are gonna be group one. You guys said they could lift maybe 150 to 175 pounds, and that they would gain 5 to 10 pounds of muscle. Is that correct? Am I remembering what you guys said? Okay, good. All right. My other group. Lana, Emma, you guys, whoever is speaking for the group, Kathy, who? Whoever's doing. You don't have a name?
Okay, we'll just go with our initials.
E-L, pardon?
Wait, PC.
PC. Okay, what'd you guys come up with? How much weight can I lift?
Well, we broke it up into like lower body, upper body.
Okay, just give me an average.
We had like 5 minutes to talk about what.
I appreciate all of those things, okay? 150 to 170, okay? And how much more, how much bigger am I gonna be? 10 to 15, okay? Thank you. Okay, Lauren, Madison, what's y'all's first name? Track. Okay, what do you guys have?
125 to 150 pounds,
Okay, how much bigger?
10 pounds.
10. Okay. Right. Group 4, Daniel or McKenna, Riley, whoever's talking.
We'll just do like muscle gains. We couldn't think of a name.
Muscle, we're just gonna call y'all gain.
Okay.
Which should probably be like hashtag gain. Okay, how much more weight can we lift? 175, okay? How much bigger?
3 to 5 times
3 to 5 pounds, okay?
of lean muscle.
Okay, very good. Whoever's gonna speak for my other group. Nikki, what's y'all's group name? Back. Okay, back of the room. Cool, all right. What do you got? 150, okay. 5% more muscle. Okay, excellent.
You didn't underline things.
Oh, I didn't underline gains, okay.
Sorry, that's the book.
That's okay. That tells me a lot about Lauren and her personality.
Yes.
All right, put those away. We're gonna actually lecture for a little bit. We're gonna come back to this, okay? You guys are in the right mindset. We're gonna come back to this in a few minutes. Okay, so the physiology of resistance training is quite complex, okay? Just to name a few things. If the idea is I do something over here, right? I lift weights, I do something over here. I put a load on my muscle, I stretch my muscle, that involves motor unit recruitment, and then all of these other things happen, and eventually out here, my muscles get bigger and I get stronger, okay? So there's a huge number of things, and this is only a fraction of them, okay? Only a fraction of things that are involved in all of this. The actual intracellular signaling pathways that are going to be involved in driving protein synthesis to make our muscles bigger would cover like 3 slides, okay? So we're not going to get into all of that. I just want you to appreciate. You don't have to know this. Nobody freak out on me, all right? It's complicated. And so because it's complicated, and oh yeah, there's probably some genetic factors in it as well that are going to influence all of this, like Dr. Veller's about some of those genetic things, although hers is more on the aerobic training side than some of this, okay? There's a lot that's going on. There's a lot that's going on. So we're going to talk in a very general sense. This happens, this happens, this happens. You're probably on average, some sort of an average person, right? None of us are average, right? Either none of us are average or we all think we are the average. That's kind of how you do surveys of people. Everyone thinks they're kind of right in the middle. And we'll see kind of what else is going on. Okay? But there's going to be some important things that are going to be here that I'm going to come back to, all right? Load or the amount of weight that you're lifting is going to be important. The amount of motor units that get turned on, right? Potentially some of the metabolic consequences of all of that. And then there's some stuff that's going to be involved with stretching and loading the muscle simultaneously. There. Okay? So here's a list of questions that I feel like most of you should be able to answer by the end of this. Okay? These are things that previous classes have asked in some of their bro science stuff. They're things that are kind of very common that a person might want to know. Like, what's the minimum amount of training that I need to do to get my muscles bigger and stronger? How much rest do I need from a number of days or between sets of doing things? Are there limits on how big I can make my muscles, right? The answer to this is, of course, yes, unless steroids, right? Kind of what happens, how do muscles get bigger, how do they get stronger? We're going to get at those kinds of things. Should I work out big muscles first or small muscles first? Or should I squat? Let's be honest, nobody wants to squat, but should I squat before I do curls, right? I always bench press first, no matter what all is happening. That's the sort of general rule. What happens when I go and I work out and my muscles feel bigger, but then magically they shrink back down a little bit later? We'll talk about this. Then my least favorite word, if we had a chalkboard, it would be like fingernails on chalkboards for me. If I ever encounter any of you saying this, I will freak out and like plug my ears and scream. Never use the word tone. Primarily, ladies, y'all are the ones I want to tone up. It's like I'm doing a comedy routine now. I want to tone up. Good. Where are my little light 5-pound weights? I don't want to be bulky. I just want to tone up. Right? Tone's not a thing. Okay? It's not a thing. What you all think of as tone, if you want to tone up, stop going to Chick-fil-A. Okay? Tone is appearance of muscles. Tone is lean. Tone is less subcutaneous fat over your muscles. Right? There is no way to lift weights to specifically lose fat in one area and whatever. You lift weights and it's the same stimulus, and you're going to get stronger, and eventually your muscles will get bigger. That has nothing to do with quote unquote tone. When most people work out to get tone, they get nothing. No strength, no size, nothing. You're just there. Okay? So we'll talk about that a little bit. All right? So I feel about tone sometimes the way I feel about the bros and their bench press. Right? Miss this idea of tone versus size. Ooh, just really does this. Should I do high reps versus low reps, machines versus free weights? This idea of spot reductions, that if I just work out one muscle, I'll lose fat in that one area, but not everything else. As you get to be my age, does muscle turn into fat? Boy, it sure feels like that, even though that's not true. And then if I'm not sore, it was no workout. In fact, we'll talk a little bit about some of these things as we go. Okay. Okay. Big picture first. Big picture first. Okay. We had Madison go and do resistance training. Madison, have you ever resistance trained before? Okay. Did you do it potentially for one of or multiple of these reasons? Were you hoping to get stronger, maybe to make muscles bigger, who knows, or potentially to increase performance in some kind of an activity? Running, jumping, whatever that might be. Yes? Okay. Have any of you done resistance training for a reason that is not one of these things? Looks like no, I will not answer. Right? Okay. So in general, this is what we're going to get. This is why people tend to resistance train. We could probably put on here something about changing body composition, changing appearance, or whatever that might be. But that's probably going to fall into some of these other things. Okay. Most people lift weights to get stronger and to make their muscles bigger, okay, or to at least maybe change the appearance of their muscles, okay? The other thing, though, that we is kind of oftentimes goes under discussed is an increase in performance, okay? And this doesn't have to be performance like an athlete. It doesn't have to be running, jumping, sprinting, or something like that, okay? It doesn't have to be, I need muscle so that if I'm an offensive lineman, the defensive lineman in football can't push me around as much or something. This can be walking, going upstairs, okay? Doing simple activities of daily living, carrying groceries, things most of y'all don't think about, okay? But as we age or as we have some sort of an impairment, this can begin to be a problem. How many of you have ever been and like worked in or volunteered in like a PT clinic or an OT clinic or something? Anybody? A few of you guys? A lot of rehabilitation that we do is in some ways a form of resistance training, and we're trying to increase strength and performance, but oftentimes it's just to get us back to a normal level of function, okay? And it looks a little bit different than the bros doing bench press on Mondays, okay? Or deadlifting or Olympic lifts, but it's really the same kind of thing, okay? So this is why it's really, really important to understand then, well, how strong can I get? What are the things that go into making you strong? What's going to change? What's it going to change? Okay? So we're going to talk about how do we cause a change? What's the stimulus? What do we need to do? We'll talk about what actually changes and then some of those mechanisms that are going to drive a lot of this thing. Okay? Two things to consider right off the bat. Okay? Right off the bat. I'm going to make my life easy. Take my 5-pound dumbbell. Okay? On the assumption that I'm going to lift weights with this 5-pound dumbbell and I'm going to do these bicep curls. Okay? What am I going to get better at doing by doing bicep curls? Regardless, I'm just lifting 5 because I don't want to like tax myself, right? I mean, I could use the 10 and probably get pretty tired pretty quickly because I'm way out of shape. But if I do this, what am I going to get better at doing? Curling. Thank you, Dylan. Okay? There's this idea with resistance training and all training, and it's called specificity. Okay? The idea of specificity is unbelievably important. Specificity tells us you're going to get better at doing whatever it is that you're doing. Whatever you're practicing, that's what you're going to get better at. So when I do curls, I'm going to get better at doing curls. Additionally, there's an idea that the adaptations that will take place that will help me get better are directly linked to the demands placed upon the neuromuscular system during that activity. So when I lift a 5-pound weight and I lift it 5 times, I am going to, if there's going to be an adaptation, it's going to make it easier for me to lift this 5-pound weight 5 times. Okay. If I do it 10 times, and it's going to be 10. And so what happens during the bout of exercise is going to have a lot of control and a lot of influence on what the adaptation is going to be. Right. So I want you all to understand that. Right. The amount of weight, the number of repetitions, the metabolic cost of those contractions, the range of motion of those contractions, all right? All of those things are going to play a role in what I'm going to get out of it on the other end. And this is a place where people screw up all the time, okay? And so because of this, we'll talk about this a little bit later, because of the idea of specificity, okay? We need to know where we're trying to go. We need to know what adaptation we want so that we can then design our program, which we will talk a little bit more about on Wednesday and probably next Monday. We need to know where we're going so we can figure out what to do to get there, right? If I want bigger muscles, I may need to train a little bit differently than somebody who only wants to get as strong as they possibly can. Right? So there's going to be some differences. The other thing to understand about training, and I think this is really important, it helps to contextualize things. Your system, this will be the case for whatever it is that we do. Biological systems like to be in balance. They like homeostasis. Okay? So if I ask Vale to get up and do squats until she can't stand anymore, we have thrown her out of homeostasis in her neuromuscular system, in the muscles that she's using, maybe in her cardiovascular system. Okay? We've thrown it out of homeostasis. Biological systems don't like to be out of homeostasis. So what's going to happen then is that disruption of system homeostasis is going to be one of the things that attempts to drive the adaptations so that the next time we ask Vale to get up and do squats for us, it does not disrupt homeostasis to nearly the same extent. Right? And part of this is an evolutionary thing. Out of homeostasis is bad because it could lead to death, okay, for whatever reason. Okay? We've removed a lot of that kind of natural selective pressure most of the time now, but it's the same kind of a thing. So we're going to adapt to limit the disruption. So these two things together, you're going to do some very specific thing. It's going to stress your system, throw you out of homeostasis. And so then that's going to drive an adaptation, right, that is very specific to whatever it was that you were doing to limit the stress the next time you try to do that. Okay? And this gets us into our other idea, the other big thing. Okay? You're going to do something and it disrupts homeostasis. You then adapt. And now you have to do more. Or now you have to do a heavier weight, or more repetitions, or another day per week. Okay? As you adapt, you have to change because whatever you were doing before does not stress the system in the same way that it once did. Okay? That's an idea called overload that we'll come back to and talk about. Okay? As you change and adapt, you've got to change what you're doing to continue to disrupt the system. You guys understand that? Does that make sense? Right? Okay. So let's talk about strength really quickly. One of the primary things that people want to increase, you will guess at how much stronger we can get with resistance training is, I want to be stronger. Okay? I want to be stronger. So strength is defined as the maximal amount of force that a muscle can generate. Maximal force. Okay? Maximal force. There are multiple ways that we can try to assess what that maximal strength is. We'll talk a lot about these things on Wednesday, hopefully. There can be specifically designed equipment like weight machines and things that we could potentially use to try to measure max strength. The most common way that we do things is something called a 1 repetition max. It is take some amount of weight and keep giving you an increase in the weight until you can't lift it anymore. Let's see if I can curl 20 pounds today. Okay, that's not too bad. Okay, if I had brought more weights up from downstairs, you could keep giving me more weight, and at some point I can't curl it. Okay, and we go back and we find the most that I can do one time. That's called a 1 rep max. Okay, theoretically, we can find a 1 rep max for any resistance training exercise that exists. Okay, we may not want to, it may not be totally safe in everybody, but it can be done. Okay. Other things that we can do is called a multiple rep max. I can take this 20-pound weight and I can lift it as many times as I can. Okay. So I can do, I don't know, how many of you guys think I can do? It's 20. This will be a fun exercise. So
Maybe like 6.
1, 2, oh, way overestimating how much my old ass can lift. 6, 7. Woo.
5 more, go.
You got it.
Oh, it's hard to go all the way down. 12, I think. This was not a great idea by me.
I'm gonna be able to move your arm up. 3 more, 3 more.
Oh, that's 15. Somebody was close.
3 more, 3 more. Go, go, go. So clean your strength.
All right, we're gonna stop at 18.
Woo.
I might could have gotten to 20, okay? But I could do this as many times. I might have had like 1 or 2 more in there. Oh, okay. But you could take that number, and there is a table, and I'm happy to share it with everybody. And we could say I lifted 20 pounds 18 times. We could estimate based upon that what we think the most weight I could lift was, okay? And it kind of runs out. So probably from that, I'm probably somewhere close to about 40 pounds or thereabouts, okay? But you can do it that way. In some people doing this multiple rep max is a little bit safer, okay? Other factors we have to consider, as you guys may have noticed, right, my range of motion was beginning to get really crappy by the very, very end, and then the type of muscle action that we're doing. So I was doing a concentric, eccentric contractions. What we were really measuring with most of this was what I could do concentrically, because remember from last week, eccentrically, I should be able to lift more weight than I can. Okay, so just we got to think about these kinds of things. This 1 rep max or your maximal strength becomes really, really important because we need to know this so that we can prescribe exercise to you at a sufficiently heavy weight with a sufficient number of repetitions in order to achieve our desired amount of movement. Okay? We need to know this. Okay. So when you're going to do training, you're going to pick things like what exercise you're going to do, what order of exercise. The really key thing, though, is going to be these last 3 things. How much weight are we going to use? What's the intensity of resistance training? How many sets? How many reps? What are our rest periods going to be? It's these 3 things that we'll talk a lot about on Wednesday and next Monday. We can try to outline kind of the best ways. Okay. We talked about specificity, and I mentioned the idea of overload. Okay. With overload, we really going to find it that training must take place at a higher intensity than what your body is accustomed to. Okay. If you're used to doing it, you don't disrupt homeostasis. Some of you may do this. Some of you may have friends that do this. I've been doing the same workout for 6 months. I go and I lift my 10-pound weights and I do like sets of 5 and I can do all of it and it's not that hard anymore. Or I go and I get on the bike, right? And I don't have a Peloton instructor screaming at me to do something different. And I just kind of go and I ride. And it's kind of the normal, easy pace. It's not that difficult, okay? So we tend to not overload enough to drive adaptations. That's one of the big mistakes with training. So we can overload our system, and this is really, really important, okay, by altering any or all of these components of our training protocol. You can overload yourself by lifting more weight, or by doing more reps at the same weight, or by doing another set at the same reps with the same weight, or by shortening your rest periods, or by changing the order of exercises, or by, if I'm doing curls, doing another kind of curls, okay? I did dumbbell curls, and I've just been doing dumbbell curls. I'm now going to do my dumbbell curls, and then I'm going to go do some curls on a machine. So there's lots of ways that we can do this, okay? But the really key thing is that when it becomes easier, make it harder. That's the real key thing, okay? That's the real key thing. Everyone sort of chuckles at all of that, right? I mean, that's the whole deal. No matter what it is, if I can give you a math problem and you can do the math problem, I give you one that's harder. You got to figure out that's how we grow, that's how we get track. Okay. All right, let's look at what we have. You guys said, drum roll, okay? We're at 100 pounds. These folks, you guys said 50 to 75% increase, 50 to 70% increase, 25 to 50%, 75, 50. So you guys were all right in the range that we would expect for increases in strength, okay? And I apologize, I thought I had a graph in here, but I don't. There's been a couple of very, very large scale studies of college students on things, but on average, over a period of say 3 to 6 months, the average strength gain is going to be somewhere in the neighborhood of 25 to 100%, okay? So if McKenna can lift 100 pounds now, she ought to be able to lift 25 pounds, but she might be able to lift up to 200 pounds, maybe even a little bit more over the course of 3 to 4 months. Okay, so that's what we're talking about. I appreciate that you guys were close. A lot of times when I do this in classes, people will underestimate, like, I'm going to get, I can lift 110 pounds. Okay, we can get a lot stronger, especially if you've not ever done things beforehand. Okay. I take my 2 guys that are on the powerlifting team, probably can't make you guys 100% stronger at this point in your lives. Okay? You've been doing it for a long time, it's hard for us to get that much stronger. There we go. Other things to note, this strength gain tends to be very similar between men and women, old people and young people. Okay? Ladies, you can increase your strength relative to your starting point just as much as the guys. That may seem very, very, very obvious until the mid 1990s. It never occurred to us that that was a thing. Okay, until the mid 1990s, they never bothered to normalize the change in strength in women to their starting point. It's like, oh, ladies, you can lift 100 pounds, and you went up to 150, but the guys started at 200 pounds and they increased it by 100 pounds to 300. So clearly 100 is more than 50, so men can increase their strength more than women, which is really, really dumb. Okay? It took us to that initial normalizing to a starting point, and we're like, oh, everybody's basically the same. Okay? Which makes a lot of sense. Your actin and myosin work the same, your muscular system works the same. There's not that much of a hormonal influence on strength. Old people, young people, all the same. One of the primary things that drives the differences in strength gain is your initial level of strength and your genetic. People that have trained more often have already increased their strength. All of us have some genetically predetermined, outside of taking steroids, level I can get to here. Okay, I'm here, I can get all the way up to here. If I train a little bit, I get some way towards that. Okay, then I train some more, I get closer and closer. And so the more you've trained previously, the closer you're going to get to your genetic potential. And that's going to then limit the extent to which you can see some increases. Okay. So there are 2 components to your strength gains. There's 2 things that happen that allow this large increase in strength. One of them has to do with your nervous system. We call it a neural adaptation. Okay? A neural adaptation. This is primarily driven by an increase in your ability to recruit or turn on motor units that are going to be inside of a particular particular muscle. Okay? So neural adaptations. The second thing that will change, we call it contractile protein adaptation. This is literally an increase in the amount of actin and myosin, so you have more cross bridges. So the contractile protein adaptations, this is the thing where your muscles get bigger. Okay? This is what we call hypertrophy, increase in muscle size. Okay? The time course of these two components of our strength gains and the individual contribution of each of them is going to be a little bit different from person to person. In general, you get neural adaptations first in, say, the first maybe couple of months of your resistance training program. Then you're going to get an increase in muscle size after that. And then you may get some further increases in neural adaptations as your muscle begins to get a little bit bigger. Okay, so generally these things are very early in your training, neural adaptations, and the contractile protein adaptation is a little bit later. We'll talk a little bit more in depth about each of these things in the slides. Okay, you guys following me so far? Okay, sweet. So let's talk about muscle fiber hypertrophy. Let's talk about the idea of a contractile protein adaptation. When your muscles get bigger, what is changing is the size of the individual muscle fibers. Your muscle fibers, the individual fibers go from looking like this, okay? Here we have a fascicle. We've got our fibers inside of our fascicle. Here's an untrained person following, let's just say, a couple of months of resistance training. Here now, fascicle and the individual fibers have all gotten bigger, okay? That's where this goes up. And the fibers get bigger because you're adding actin and myosin. So your sarcomeres are getting bigger. You're adding more sarcomeres, so your myofibrils get bigger. As your myofibrils get bigger, then the individual fibers are going to get bigger. As the fibers get bigger, then the whole muscle is going to expand outward. Okay? So the adaptation takes place at the protein level, but that drives the increase in the cell size and the whole muscle size. There is a concept of something called hyperplasia, which happens in animals, but we don't think it happens in us. You guys ever heard of hyperplasia before? Lauren, what is hyperplasia?
I don't know, but I've heard.
You don't know, but you've heard of it. Okay. I'm sorry, Kathy? So you're very close. Hyperplasia refers to a concept whereby to make a muscle bigger, I don't make the individual fibers bigger. What happens is I go from having this number of fibers to each fiber might split, like kind of straight on mitosis. And I'm going to double my number of fibers, and so I'm packing more in that particular way. That's why the muscle is bigger. Okay. Hyperplasia is something we see sometimes in lower animals, mice, rats, cats. We don't think it happens in people. Okay, we're not really sure why, but we don't think it happens in people, especially if you don't take steroids. The problem is it's almost impossible for us to test this. Okay, to test for hyperplasia, I have to take Adriana, cut open her bicep, pull out her bicep muscle, dissect it, count all of those muscle fibers, then reconstitute it, put it back in, sew her up, let her heal, have her resistance train, cut it open again, and then count all of the fibers again and see if our numbers are the same, or more or less. Adriana, you want to volunteer for that particular experiment? No, thank you. Okay, that's a good response. I wouldn't either. All right. And so because of that, like, we don't really know. All we do is they count fibers in cadavers, and we look in people that have died, who trained some who didn't train, and all of this, and we try to make some assumptions. We don't think it happens in people. Okay, we don't think it happens in people. We think this is the primary thing. In some ways, it doesn't really matter. Your muscles are going to get a little bit bigger. Okay. All right. So here's what we could see. These were some guys, some spinal cord injured guys that we trained, and I want you guys to note that in 3 months, see how much bigger this particular guy's muscle got. Okay. This was from doing 80 contractions with his quads per week. 80 contractions. All right. In 3 months, they got about, this is about a 75% increase, and they got a little bit bigger at 6 months. All they did was lift like barely the weight of their leg. We had them sit off the corner of their bed, they put electrodes on their legs, and they cranked up an electrical stimulator. They did a knee extension, and they cranked it back down and it went back down. And when they could do 4 sets of 10 with the weight of their leg, we gave them 2 pounds in ankle weights, and they started doing that. If that changed, then we would just progressively add those things. 2 days a week, 4 sets of 10, 80 contractions per week. That was all it took to make this happen. Okay. So when we go and the bros are doing like 18 different chest exercises today, I'm not sure what they're doing. Okay. They're just there to be them. So they can look at themselves in the mirror and justify whatever protein powder they're taking in the midst of all. Okay. So that's a little bit of a misnomer. I mean, these guys hadn't moved their muscles. They hadn't moved their legs in years. And so they were super duper untrained. You can see then that we couldn't get a little bit more. So it might take a little bit more than 2 days and 4 sets of 10 for us to see this kind of thing. That's kind of what we've got. Okay. So we can see changes if we take a muscle biopsy in the amount of myosin expression pretty quickly. But in general, if we're going to see a noticeable, like visual change in your muscle size, it very often takes, 15, 16, 18, 20 kind of workouts, which if you do it kind of the way we prescribe, is usually going to be somewhere in the neighborhood of 7 or 8 weeks or 10 weeks of exercise to see a noticeable, measurable change in muscle size. Okay? And this is terrible from an exercise adherence standpoint. Okay? If Phoebe's got to go work out for 8 weeks before she can see a change in her muscle size, she may get very frustrated. Right? I would get frustrated. I have gotten feel like I'm just killing it and nothing. Look at this, right? It takes a while. Okay? And a lot of this is because you have to drive these changes in myosin expression, drive changes in actin expression, and you have to consistently do this for weeks and weeks and weeks for you to accumulate enough of these little bitty proteins to see a measurable increase in muscle size. Okay? With high resolution imaging, like with MRI or with the CT scan, we may be able to see some very small changes at a month or at 6 weeks, but usually it's going to take kind of somewhere in the neighborhood of 6 to 8 weeks for us to see those increases. Okay? So, are there limits on how big you can get? Right? You guys said I can add 5 to 10 pounds, 10 to 15 pounds. Somebody said 5%, 3 to 5 pounds. And we're all kind of in the same range. Okay? We assume that there is a limit. Okay? We assume there's a limit. You can't have Taylor just go and work out and then she's just going to look like The Rock at some point if she just trains for like 5 years. Okay? To be honest, none of us are going to look that way, no matter what it is that we do. He's had a little chemical enhancement on some of those things, right? Especially recently. We assume there is a limit. We don't have very good data. Again, we don't know how big people can get. And oftentimes the people that have gained the most muscle mass for life have taken steroids. So we don't really know where things are. In general, over the course of 3 to 6 months, an average person is going to be somewhere in this maybe 15 to about a 40% increase in the cross-sectional area of their muscle. It is very much affected by genetics. We could spend like weeks talking about sort of the genetics that drive some of these kinds of things. We also know that can be very affected by taking steroids and some other drugs. Okay, so the question then becomes, all right, 15, 20% increase across most people. What does that actually translate to in weight? Okay, if we have a 100-pound person and they made every muscle in their body 15% larger, that's not 15 pounds, right? Because you're not just all muscle. You're water and bone and adipose tissue and organs and all kinds of things, okay? So we did some calculations in my graduate class a few years ago. And if you take a 150-pound person who has 15% body fat and you increased every muscle in their body by 15%, they would gain approximately 8 pounds. Okay, every muscle in their body. Any of you guys in your total body workouts train every muscle in your body? I guess it's probably not. Okay, so many of you guys saying this 5 to 10, 10 to 15, it's a very reasonable amount. Okay, it's a very reasonable amount. Because when you add these things, you're probably not just going to add muscle, you're going to add, as the muscle gets bigger, there's going to be more water that's going to be in there. So these are kind of very reasonable sorts of things. What becomes unreasonable is when the bros tell us, dude, I put on 40 pounds of muscle in 3 months or 6 months. That's all bullshit. Okay. They may have put on that much weight, but it's not all muscle, right? There's, additional adipose tissue and a bunch of things. If they really put on that much muscle, they're taking steroids. You'll see athletes and they'll say things like, oh, it was the off season. He gained 20 pounds of muscle. No, he did not. Okay. Maybe you take an 18-year-old football player, an 18-year-old basketball player, who's a guy who's still actually growing. Maybe in that instance, it's going to be the case. But in general, we dramatically overestimate the ability of people to get bigger. Okay. Ladies, go train, lift heavy weights. You're going to be fine. Your muscles aren't going to get that big because no one's muscles get that big. Okay. Nobody's going to be most people are not just going to be these great big look at the rock kind of guys. Okay. There is a large genetic component to that, right? There's plenty of people that we know you can train perfectly, you never get bigger. Okay? Never get bigger. Other people, they just look at weights and they blow up. Okay? There's some genetics behind all of this. So again, thank your parents or curse your parents. Other things to understand about what's going to change inside the muscles with resistance training. We will see fiber type conversion from type 2X fibers to be converted into type 2A fibers. This may seem counterintuitive, but again, when you have type 2X fibers and you make them contract, you disrupt system homeostasis by a huge amount. They fatigue very easily. They're very, very metabolically inefficient. And so it's not great to have them around. So when you do any kind of activity, walking, running, resistance training, doesn't matter. We're going to convert 2X fibers into 2X. Okay. Now, there's some really interesting kind of questions and data out there on, is one of the things that drives the genetic differences in training responses due to differences in fiber type, okay? Due to differences in fiber type. Let's just say that Riley has a lot of type 2 fibers and McKenna has a lot of type 1 fibers. The thought in the past was that maybe having more type 2 fibers genetically, type 2 fibers have a greater potential to hypertrophy than type 1 fibers. Okay? That was thought. What we now know is that's generally not going to be the case. Okay? All fiber types, when you train, will tend to increase in muscle size. Okay? The percent increase is going to be relatively similar, but the absolute size increase will be different. Okay? Because type 2 fibers tend to be bigger in general than type 1s, when they hypertrophy 10%, that's a larger absolute increase in size than what we see in type 1s. Okay? But percent-wise, it all seems to be relatively similar. Okay? There's some other things that go into this as well, that very often the fibers that are going to increase the most in size are the ones that you use the least often in your everyday life. Okay? If I took most of you, we're not going to do that now. But so since you tended to use your type 1 fibers earlier in recruitment over than some of your type 2s, the ones get a lot of use. They're already being stressed more than the 2s. So they may be closer to their genetic potential initially than some of our type 2s. There's some interesting kind of data surrounding all of this that we go into in my graduate classes, but it's kind of beyond the scope of the okay. The last bit is something called transient hypertrophy, which I think is a brilliant marketing and capitalistic kind of entrepreneurial idea. If anybody wants to invest with me, we can do this, okay? You guys probably can't see this, but my right arm feels very swelly right now, having done my one set of 18 repetitions, okay? What has happened is that my right bicep has increased in size immediately, and this is mainly due to swelling or edema within my muscle. This has happened because of two things. I metabolically taxed my muscle, so that changed the internal environment, and it drove fluid from the interstitial space into those muscle fibers. I also increased the blood pressure going to that muscle, and so the pressure in my blood was higher than inside the muscle, so I moved plasma from the blood into my muscle. Okay, so it's oncotic and hydrostatic pressures are going to change. So what happens is I get a transient change in the size of my muscle. If you looked at my muscle, if you imaged me, if you put a tape measure around, it's bigger. That's real. But give me another hour or so for my blood pressure to go all the way back down, for the oncotic kind of metabolites to be spread back, and it's going to go right back down to its normal size. I've not magically generated new or bigger muscle fibers in 20 minutes. Okay? Transient hypertrophy, oftentimes referred to as a pump, right? So we go, you work out, you're like, oh, I'm feeling big. Look in the mirror. What's up? What's up? Okay? That's what's happening in the midst of this. I think we have a brilliant opportunity. Can you imagine? I think every bar downtown, we should install some weights in the men's bathroom. We let them all go in there and pay like $2, and they can do some curls real quick. So their medium shirts are going to be even tighter, and then they can go back out into the bar. We can sit on a fortune here. Okay? So my thoughts, but nobody seems ready to invest in this. That's the idea of transient. Okay, there's hyperplasia. We talked about that. All right, let's talk about something called myostatin, and then we'll take a little break. Okay. All right. Myostatin, what you guys see here, this is a Belgian blue bulb. Okay. My dude here is he's pretty jacked up. He's ready. Okay. Don't want to mess with him. This guy's never lifted weights in his life, and yet look at these muscles. Okay. He has a genetic change where he does not express something called myostatin. Myostatin is a naturally occurring protein, and it blocks, okay, it blocks the function of satellite cells, or blunts the function of satellite cells. The more myostatin you have seems to be correlated to a reduced potential to make your muscles bigger. Okay, so if you have no myostatin, you can be really big and really jacked. Okay, we think it's there to protect muscles from getting too big and too strong. So in many ways, it's considered to be an anti-growth factor. Okay, if hormones like testosterone and growth hormone and insulin like growth factor 1 are anabolic and drive bigger muscles, myostatin is going to be a protein that blocks this. Okay, there are people who do not express myostatin. There are dogs, there are cats, there are rats, there are mice. Go on Google and just search for, right, myostatin deficient X, and you'll see them. There's dogs, they're very scary, right? Like they're these just like great big, like just really, really muscular dogs. There's some things, there's these poor little rats that don't have it, and the myostatin deficient rats just look like Mighty Mouse in some ways. All right, they're these big, just Google it, look for it. It's there. Okay. There's pretty good evidence that several people that have been Olympians do not have myostatin, express myostatin. Okay. There's documentation of these little babies that don't have myostatin. And I can tell you, one of the best things about babies, now that my child, Ellis, is not a baby anymore, is I miss the sort of Michelin tire man squishiness of all of them. Myostatin deficient baby looks like a freaking 10-year-old, right? Like it's like a month old and it has a defined vastus lateralis. I assure you that's not normal. It's not the way it's supposed to be. Okay? And so they lack these things. can be passed on genetically. This is one of the things that we know goes into that. If you're interested in sort of biomedical engineering, and I'm sure people are working on this, and maybe there's some things that we don't know about that they're doing. If I could give you a pill and block the function of your myostatin, I can immediately increase your potential to increase muscle size. Okay? So, sort of biomedical engineering to make people better, potentially better athletes or bodybuilders or something by changing all of them. Okay, let's take a 5-minute break here. Okay, and then we'll come back and we'll talk about neural adaptation. Okay. So we talked some about muscles getting bigger. Right? There's some debate. The debate I don't like to participate in, but there's some debate as to the extent to which the increase in muscle size, like what role that plays and how much stronger you want to get. But you can note from all of this, right, that from what we showed already, that you can get a lot more strong, you get a lot stronger than you can increasing muscle size. You get 100% stronger with 15% bigger muscles. Okay, and so there are some people that argue that increasing muscle size plays no role in the extent to which you get stronger, which I think is just patently ridiculous. But anyway, so the other piece of things that plays this role in strength are these neural adaptations. They're sometimes called learning effects. You guys remember the idea that, right, like once you learn how to ride a bike, you never forget in some ways. Once you learn how to curl, you never forget, or once you learn how to squat, you never forget. And so the nervous system has this tremendous ability to, we're going to call it remember, even though that's really not the right word, but to remember a motor pattern and what it needs to do to perform a certain range of motion at a certain amount of force. Okay? So these things happen very, very quickly. Right? So if we wanted to do something fun, which we're not going to do in our lab this time. So when we normally do our lab, when we assess muscular fitness, we do a 1-rep max on the bench press, which is my absolute favorite day of class, right? We get to watch people that don't generally bench press, and it's the best, okay? If you guys do this, you're not very good at doing it, we can have you come back at the next class period and you do it better, okay? When you do things you've never done before, you are immediately going to be better. So we can see neural adaptations to a bout of resistance training where you are stronger the next time you go to work out, especially if you're doing something you've never ever done before. Okay? So if you've never done a squat and we have you squat 50 pounds, you can come back 2 days later and you can probably squat 70 pounds. So they occur very, very quickly. And they tend to occur well before any change in the muscle or the muscle size is going to occur. Okay? This is the thing that primarily drives the strength increases in the first, say, 6 to 8 weeks of a resistance training program. Most people, if they are untrained, get a lot stronger really, really fast at the beginning of a training program because you get a lot of these neural adaptations. They get a lot better really quickly, and then it slowly kind of plateaus off and will begin to climb at a much, much slower rate. And again, that's not great from an exercise adherence standpoint. It's not great from a psychological standpoint. If you think, oh man, I can lift 20 more pounds than I could 2 weeks ago, that's going to continue for forever. And it's not. Okay? It's not. The other interesting thing about neural adaptations is they're very, very specific to the type of exercise. We go for set number 2 here. I do curls with a dumbbell. Okay. I'm going to get better at doing curls with a dumbbell that weighs approximately whatever this dumbbell weighs, which is 20 pounds. There's going to be a little bit of transfer that if I was going to do with a barbell and do curls with both hands simultaneously, or if I was going to get in a machine where I do curls with like one arm or both arms in a machine, there is some transfer, but the biggest transfer is doing exactly whatever the movement was through the exact range of motion, okay, that I did when I was doing the sort of the training portion. Very, very specific to exercise type. So that is something we have to be very careful of, especially in real world settings. If you're doing rehab on somebody, you need to make sure that whatever you're asking them to do is going to be very close to whatever it is they're going to need to do in their everyday life. And we're trying to get them better at, okay? It's better at carrying groceries than we need to do exercises that are going to as closely as possible mimic carrying groceries or going upstairs or whatever it's going to be, okay? So we just need to be very, very kind of aware of what that is. Why is my clicker not working? Okay. So these are just some pictures that show sort of what all is going on, right? This is the percentage of your strength gain that is due to each kind of thing. Here's our training time down here. So here's kind of this 8-week, magical 8-week period where you may see some increases in muscle size, but you'll note in the first couple of weeks, like all of my increase in strength is due to neurofactors. That tends to decline progressively over time. I'm then going to get some increase from my increase in muscle size. That tends to plateau off a little bit. And we get out here in very, 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 very advanced lifters. In people that have generally gotten very close to their genetic potential for muscle size, the only way they're getting stronger is through nervous system adaptations. And that's an instance when maybe doing some of these weird lift really fast or lift really slow or work on our small accessory muscles and these other kinds of things might become important. But in a normal person, for most of you guys, okay, just go in there, lift some weights until it's reasonably heavy, till you can't do it anymore, and then come back and do it again the next time, and you'll be generally in a pretty good sense, in a pretty good place. Okay. So what changes? What's the thing that goes on that allows these adaptations to happen? So one of them is an increase in your ability to recruit motor units. I think we talked about this last week, but again, we overlap with my grad class, so I get a little bit confused. So most of you, okay, most of you, especially in large muscles like your quads, okay, are not able to turn on or recruit all of the motor units, and you're not able to get all of the muscle fibers in those big muscles to contract, even when you try as hard as you can. So there's some room to be able to increase those things, okay? And that's one of the things that training does. As you force the muscle to lift something heavier and heavier, or as you force the muscle to lift something more and more times and get closer and closer to not being able to do it anymore, you're going to force the brain to try to turn on as many motor units as it can. And that's going to lead to an adaptation, which we're going to say an increase in neural drive, and an adaptation that allows more motor units to be recruited the next time. So one of the adaptations is you can just use more of the muscle that you already have. Okay. Another one is going to be something called an increase in the motor unit firing frequency. So you may be able to sort of send more action potentials to muscle fibers and get more of them up to the plateau portion of their force frequency curves. This is hard for us to test, but we think there's a little bit of this that's going on, but it really, most of it is due to increased recruitment. The other thing that happens is we're going to get more synchronous motor unit recruitment, or a better order of muscle recruitment. You ever do something and you feel uncoordinated while you're doing it, right? And you come back and you do it again and it feels much more coordinated, you feel much better, right? It's my experience every time my wife drags me to go do yoga, right? I'm like, how do I like do this, hold myself, or I'm supposed to like grab something, right? This now Instagram it, right? Like I'm supposed to be doing this, like out by the beach or something. No, nobody does that. Okay. Anyway. You have to turn on, most movements involve more than one muscle group. And so you have to be able to turn on those muscles at just the right time right, with just the right amount of force in relation to your other muscles to execute that movement correctly or as well as you possibly can. And so that is one of the things that we also think is going to change. Get more synchronous firing of motor units, more synchronous firing, or a better kind of pattern of recruitment of all of the muscles that we're using. Okay, so some of this is going to be driven by increases in the neuromuscular junction area, so we get a better transfer, more motor unit recruitment. We're going to get a better activity of something called the stretch reflex, which we will not really talk much more about. But when you stretch a muscle, you activate muscle spindles, and they reflexively try to get you more force out of that particular muscle. That's the idea of the tendon tap reflex. If you sit and I hit your patella tendon, right, you're going to kick out. One of the things is you're going to get a larger activation of that. Do you guys talk about Golgi tendons at all in anatomy or in human phys at all?
Yeah.
You guys talk about Golgi tendons? Oren says yes. The rest of you are looking at me like, what the hell is a Golgi tendon? So you also have these things that are called Golgi tendon organs that they sense force production in the muscle. When the muscle produces a lot of force, the Golgi tendons get turned on, and they're going to inhibit further force production. They're there to kind of be like a safety mechanism in the muscles. We have good evidence that as you train and you lift heavier and heavier weights, you somehow convince your Golgi tendons that you're not going to tear your muscles apart, so they stop getting turned on as much. And that is going to then lead to less agonist or less kind of inhibition of those muscles. You can train your Golgi tendons without ever having to move. You can get a real heavy weight, put it in the squat rack, and then just stand up with the weight and never actually do squats and just stand there. And you can train your Golgi tendons to become less active. You're just sitting there with a heavy weight and you've not ripped your quads in half. So it will do those things. Part of the synchronous part of muscle firing is you actually decrease antagonist muscle activation during the movement. So I learned when I get better at doing curls, I learned to shut my tricep off while I'm doing that curl, so that I don't have to lift the weight and generate force to overcome whatever my tricep is doing. So that happens. And then there may be some ability to preferentially recruit type 2 fibers when you do higher force levels. Okay. So these are some of the actual kind of physiological changes that are going to go on, or neurological changes that are going to go on, that lead to these observations of the adaptations, and that are going to lead to, in general, getting more force production. Okay. Questions about any of that? Okay. So we're going to do a little bit on bones and connective tissue. I am not an expert on bones, nor am I an expert on connective tissue. So we're going to just kind of breeze through some of this. But it's really important. These are really important adaptations, especially for athletes and especially for bone things for post-menopausal women who are at a very high risk of something called osteoporosis, where you lose bone minerals. I'm sorry, ladies, it's going to happen to all of them. Okay? One of the things that we know is when you do resistance training, that what happens in your bones is the bone mineral density. So just think calcium. Okay? When you do resistance training, you increase the amount of calcium that is deposited into the bones that are sort of around the muscles that are being used for resistance training. Okay? What we know is that when bones experience high levels of force, that puts stress on the bones, and those bones bend ever so slightly. So when I do a squat, if I can do a squat, I do not wear, these are my stretchier dress pants. Let's see if I can do a squat. I do a squat and I get way down like this, okay? I'm lifting that weight. My femur is ever so imperceptibly, it's flexing just a little bit. It's bending just a little bit, okay? When I do all of this and I'm compressing the vertebrae in my spine, that stress is going to tell bones, okay, deposit more calcium in those bones in those areas. Because over time, and it takes about a year to see this, maybe 9 months, over time, as I deposit more calcium, those bones get bigger, they get stronger, they're less susceptible to fracture. Okay, they're less susceptible to fracture. And so that's how we're going to be able to do all of this. Okay, we'll talk about osteoporosis towards the very end of class. Okay, and we'll talk about changes in postmenopausal women, the drop in estrogen. Estrogen is a thing that is protective on bones. You need some estrogen because it inhibits parathyroid hormone. Parathyroid hormone causes bones to be broken down to get calcium. So there's some things that are going to be in there. Okay, but when you lift or when you run or jump, okay, every time I jump and I land, I compress my spine. I'm compressing my femur when I do this. Okay, these are going to do things that are going to be good. They apply force on those bones. That increases the strength of those bones. Okay. All right, so here's sort of normal kind of bone matrix. Here's weakened bone matrix. These are images taken from the neck of the femur, okay, kind of right here near the acetabulum of the hip. And so these more, as you lose calcium, you're going to have these more porous bones, more of a honeycomb look. Okay. Let's talk about connective tissue. So here's some connective tissue, things that we're going to see inside of a ligament. Okay. But in general, tendons and ligaments are going to increase their strength and their elasticity in conjunction with the increase in strength of a muscle and the increase in strength of those bones. The primary thing that happens when I stress and I pull on ligaments and tendons is that they're going to get more collagen deposited into them. It's going to increase the sort of strength of that ligament. All right. This increase is going to help prevent injury as muscle size and muscle strength goes up. One of the hallmarks of athletes that are taking steroids is injuries to ligaments and tendons because their muscles get bigger and stronger faster than they can change the strength of their tendons and ligaments. So it outstrips those things and they can get a lot of force and the ligaments and tendons can't handle all of that force. And so they get lots of ligament injuries, strains, tears, things of that nature. Okay. So again, like with the bones, it's the high force level and the high stress, that stretching of those things. It disrupts the homeostasis inside there. And so that's going to drive deposition of more collagen to make them stretchier or more resistant to some of that other stretch. And that's going to be good for us long term. If you want to, independent of some of these things, increase all of this, you need to take a gelatin supplement. Okay? I didn't say just eat Jell-O, but it's sort of similar. They make it, you can buy powdered. It's gelatin. It's made from just what you think it is. It's force foods and those kinds of things. But it has collagen. It's a collagen supplement, basically. There's some really good evidence that if you do that with exercise, you can get even further kind of increases in connective tissue, ligament and tendon strength. That's one of the few supplements that if I was still an athlete, doing things that I would actually take. There's good evidence that this works. Okay? That taking a collagen supplement actually works. Most of you probably don't need protein powder. Most of you probably don't need carbohydrates or anything else as long as you have kind of a normal diet. But this stuff is going to actually do it. Okay. I think I have like one slide on adaptations to disuse. Everything we've talked about today up to this point, when you stop doing things, it all goes away. That's disuse. Okay? Your strength goes down, your muscle size goes down, your bone mineral density goes down. Right? Your tendons and ligaments maybe a little bit less so. But that's the thing. Your fibers get smaller, you lose mitochondrial enzymes, you reverse this fiber type conversion from 2A back to 2X. You lose force, your protein synthesis goes down, and so that leads to what we call muscle action. Your muscles get a lot smaller. Okay? This happens really fast. Really, really fast. Okay? In a 2-week period, we did a study in a 2-week period when I was a PhD student, where we gave people a big shoe that had a platform on it and a pair of crutches, and they crunched around like this. Okay, for 2 weeks, everywhere they went, their left leg was swinging. When they sat down, they had to prop their leg. Got up in the middle of the night to have to go to the bathroom. You need to hop, crunch yourself around. Okay, did not bear any weight on that leg for 2 weeks. It simulates being in space, simulates zero gravity. In 2 weeks, they lost 8% of the muscle mass in their quad and their lower leg. 2 weeks. In a month, they lost 15%. We paid them $1,000 to do this. You guys crutch around for a month for $1,000. Literally every one of them said, absolutely not, never again. You need to pay us like 5 times this much. So, but it's a thing that's meant to mimic space flight. They did all of this. It goes away really, really fast. Okay? You guys have seen the reports, right, of the people that have to go on the ventilators because they have COVID and they're in the hospital for like 6 weeks or something, and they come out and they've lost like 70 pounds. Okay? Being on bed rest does the same thing. It's not quite as fast, but it does basically the same thing. Okay? So when we don't bear weight on a muscle, it's going to atrophy. This is why walking is good. This is why just standing up in some ways is good. It doesn't take a lot to lose everything because the balance is so delicate. Okay? Things to consider. Okay. So let's talk a little bit about training programs, and we'll get into this a little bit more so on Wednesday. Okay. But if you look at how you're going to go off in a resistance train, if you're going to go off today and do something, anybody going to resistance train today? I haven't convinced the rest of y'all. It's okay, I'm not going either. It's fine. No worries. Okay. For those of y'all that are going, okay, we can calculate something called a training volume. And volume is, everybody defines it a little bit differently, but in essence, it's the amount of weight you're going to lift multiplied by the number of repetitions multiplied by the number of sets. So it's like basically, I'm going to do something, I'm going to lift this 20-pound weight some number of times. So that's my training volume. I can make volume go up, maybe by lifting a heavier weight, maybe by doing another set, maybe by doing more repetitions within a given set. Okay? Normally, if we want to overload a muscle, we generally have to do something to make our volume go up. Whatever you guys are doing today, okay, I hope your volume is maybe a little bit bigger or a little bit more than whatever you did last week. Okay. Now, that can't always go up indefinitely. There's a lot of kind of nuance in this. That's okay. So here's some other really fascinating stuff. There is scientific evidence that if you're a person who is not trained very often, you can go lift 1 day per week and do 1 set of 10 repetitions and get just as strong as if you were doing multiple sets of 10 repetitions on multiple days. That lasts for about a month or so, okay? But if you've never done something, 1 set can be enough, okay? Especially if that 1 set is to what we would call failure. Lift that weight until you cannot do it anymore. That's the key thing, okay? Training for strength, so this is versus training for size. This is one of the areas that there's a lot of confusion to me out there, okay? Can you train to make your muscles bigger without them getting stronger? No. Can you train to get stronger and focus more on strength rather than size? To me, no. Okay? When you get one, you're going to get the other. People will argue about this until they are blue in the face, and I can point you guys to the couple of scientific studies that started all of this. But here's the deal. Ideally, if I want to try to train to get as strong as I possibly can be, I need to lift very, very heavy weights for me a very few number of times, right? If we judge my increase in strength by the most weight I can lift once, I need to practice lifting a heavy weight 1 or 2 times in order to get that specificity to drive that strength. Okay? So long recovery periods between sets, high weight, lower reps. That's what people generally refer to as training for strength. Okay? There's some utility to this. If your ultimate goal is to lift the most weight one time you can ever hope to lift, I would say just go practice that all the time. Just go do 1 rep maxes when you train. Do a 1 rep max, wait 5 or 6 minutes, do another one. Do another one. Okay? That's probably the way to get the closest to doing that. When you want to train for quote unquote muscle cells, one of the things that people will talk about is you need to do a more moderate load for a more moderate number of reps. So that moderate load may be 60 to 80% of whatever your max weight you can lift is going to be, and do maybe 6 to 12 reps. And then people talk about, oh, well, you should not rest very long in between sets. There's some evidence that doing these short rest periods maximizes growth hormone release and allows for the recruitment of those motor neurons. Problem is that this and this idea are old science. This is old science. We have new evidence. Have I talked to you guys about how to be a good scientist, you have to be willing to change your mind and get new evidence? That's the thing to me that people have had the most difficult time with about the pandemic and about COVID. We started off, we didn't know anything. So we thought, oh, well, maybe it behaves like the flu or like one of the other coronaviruses. So that led to, we don't need a mask to start with because we don't think it's really transmitted airborne that much. And then we're like, oh, whoops, we're 6 months in, we know a lot more. Actually, it is that, so please wear a mask. People are like, but you said before, now you've changed your mind. You're like, well, shit, we know more, right? It's like everything else. You touch the hot plate, you learn. Don't touch the hot plate anymore. Okay? There's evidence that if I do, say, sets of 10 or 12 with a relatively kind of moderate weight, and I only rest like a minute between sets, that I do actually get more growth hormone release out of a particular training protocol versus doing something else. And so based upon that, an entire society decided, I'm going to train for muscle size, so I need to do it this way. What they never asked themselves was, does that increase in growth hormone actually translate into giving you bigger muscles? We have evidence now that it does not translate to an increase in muscle size above and beyond things. So we make a thing and it makes plausible sense that it should do that, but they never did the other step and said, if you train this way for 3 months, you actually get bigger muscles than the person that does a little bit heavier weight with kind of a little bit longer rest periods and fewer reps. And the answer is no, you don't. Okay? We have very good evidence now that the acute change in testosterone and growth hormone and other sort of endocrine changes after a bout of exercise does not play a role in muscle hypertrophy. If I give you more testosterone, if I give you an above a physiological dose, that's good. If you're deficient, right? We have men that don't make testosterone or women that don't have estrogen, or you're deficient in growth hormone. Yeah, that makes a big difference. For a regular person that has a normal amount, the acute change doesn't do it. Okay? So that's my thing. If you want to get bigger, you're going to get stronger. If you want to get stronger, you're probably going to get bigger. Do something. Do this. Okay? Pick a weight you can lift 6 to 12 times. Do a couple of sets of that. Do it a couple of times per week. When it gets easier, add more weight. Or change it up if you're bored and do a couple more reps. Whatever. That's the key thing. Most people don't train like that. They don't train very well. They overcomplicate everything. Right? Go bench press, go squat, go deadlift, do a few curls, do some lat pulls, right? Do some back extensions, you're fine. If I see you doing calf raises, I'm going to laugh at you. You bear so much weight on your calves every day anyway, they're not getting any bigger. You walk around, your calves get a workout, trust me. Okay? They're not getting much bigger. Also, does anybody really care how big your calves are? They know you care? Okay. Care for yourself, okay? Like that's the first thing you notice in somebody else is, ooh, look at those calves. Right? Just for you, just like I want calves.
Some
Okay?
people have really big calves though.
Yes. As one of those people, I blame my mom. I have kind of square legs, right? Like my pants rub the hair off the outside of my legs because my calves are larger. Maybe that's why I'm like, oh, whatever. Who cares? I already have pretty big calves. But I see people doing that. I'm like, why are you doing calf raises? This is silly. Right? Ooh, my soleus is going to be so big. Right? Okay? This is my kind of way of doing this. Okay. I want to be done. We've got like 7 minutes. Okay. We'll stop here. We'll talk about muscle injury and muscle damage for Wednesday. Okay. Please make sure that you turn in whatever it was that you wrote down for me today. If you did it like on your computer, email it to me. Make sure all your group members' names are on it, or they will be very mad at you when they don't get credit. My Zoom folks, please just email it to me. All right? Okay. I'll see everybody on Wednesday.